welcome to Community Connections. I'm Marnie Uhl, your host. Glad you're joining us today. It is February and we're excited. Lots of good things are going on. Just do want to remind you, American Heart Month. So maybe this is a month and as you remember and treat your Valentine to something special, treat yourself, get your heart checked out and make sure everything is working properly. And it could be diet, exercise, a lot of things, but we're looking at, all of us kind of taking a look at our little thing that keeps us going. So again, American Heart Month and celebrating Happy Valentine's Day. My first guest is Deanna Eder. She's at Eder. She's the Director of Marketing for Polara Health, along with Melanie Jacobson, who is the new Senior Peer Program Manager. And the Senior Peer Program is one of my favorite programs that got started years ago in support of our senior population. And it's undergone a lot of things, but we're going to let them talk about it and say how you can maybe help. Deanna, tell us about Polara Health.
Well, Polara Health is a nonprofit organization that's been in our community since 1966, so over 56 years now. And we work with everyone in our community from birth to end of life, mental health, behavioral health. We've got our crisis stabilization unit, and we're in a big growth stage right now. We have now over 400 employees in our organization, wow. And we are moving into some new facilities in the area. So we are super excited about what we're doing and what we're going to be able to bring to our community. And so today we wanted to talk about our Senior Peer Program, which is such an amazing program. But if you need us, call 928-445-5211 or go to our website at polarahealth.com.
Just really quick, tell us where the crisis stabilization unit is, because that is somebody is in crisis and you really don't know what to do, and it's not necessarily a police situation or law enforcement doesn't need to be involved, and this is a great place that they can go and get help right away. And that's right. Located where?
So it's right behind Tractor Supply in Prescott Valley over on East Ridge Drive, and it's open 24/7, and anybody can walk through our doors and we will walk them through what the needs are. So if they need a safety plan or resources, or they need 24 hours just to sit in a chair and gather themselves. So we will figure it out once they walk through our doors, but let us help you.
Amazing unit. Yeah. So impressed that we have it here in our community. Just another great thing we've got here.
Absolutely.
Okay, Melanie.
Yes.
How you doing? We're just getting adjusted here. That's what we do. Anyway, so let's talk about the Senior Peer Program.
Okay.
Now you're overseeing that.
Yes. The program was started in 2003. It was originally called the Senior Peer Prevention Program because the goal of the program was to match healthy seniors with isolated seniors to prevent the consequences of isolation and loneliness. Typically, dementia and Alzheimer's can come on faster if a senior is alone. Substance abuse, just being totally isolated, it's not good for our souls. So the program was started, and it has grown over time. Before the COVID, we had 75 volunteers.
Wow.
And 134 folks who were being given companionship. And what happened with COVID is the whole purpose of the program is for people to be together.
Right.
Based on, one-on-one. And that wasn't possible, particularly with our age group.
Right.
We serve seniors 60 years of age and older. And so the program kind of withered on the vine.
Because even some of those companions, the seniors that were your volunteers, were now affected with the isolation themselves.
Indeed.
And so nobody was able to get together.
Right.
So, okay,
right.
fast forward 2023.
What are we doing?
What are we doing?
Yes.
We are rebuilding. We are,
okay.
I have a small list of those waiting to have a match for a companion, a senior companion. And our primary goal right now is recruiting volunteers.
So what are you looking at in a volunteer? Are there some requirements or any special skills, things like that?
60 years of age and older. We do a background check, fingerprinting, to make sure we're not getting someone who wants to take advantage.
Unfortunately, we have to worry about that, don't we?
Yes, we do. And so really it's just about matching women with women, men with men. We want them to have a shared life experience.
Okay.
Growing up around the same time. You all know we're all boomers now.
But there is
So-
different ages of boomers.
Oh, indeed.
You
It's
know,
like
yeah.
25, 30 years.
Yeah.
So we are focused on just getting folks who want to give back to their community. There are so many, well, as we know in this area, the Tri-City, Quad Cities area, 42% of our population is 65 years of age and older. And so many folks come here to retire. They have left their families, their folks, their lives, and they come here and a spouse dies.
Yes.
And they're alone, their children are somewhere else, and they want to give back to their community, and so they're a perfect fit for coming in and making someone else's life enriched.
So, we talk about getting them together. Is it just companionship in the home, or could they develop a friendship and say, let's go to the movies? I tell you, I have a lot of friends that are in that age group, and that's what we do. We do things like go to the movies or we have dinner.
Some of our remaining volunteers have been with their senior for 10, 15 years, and
So it is a friendship.
they become very,
Absolutely.
very fast friends.
Yeah.
We also have support groups. We have a blind low vision support group, a men's group, Women of Wisdom, a women's group, Women of Wisdom, a men's group, and a meditation group. And we hope to expand to have one of our more popular programs before COVID was Singing in the Keys of Life, where folks just came in and the volunteer facilitator played a guitar and they got to sing whatever songs they wanted to sing. Yes. We're also wanting to establish a grief and loss grief and loss group, given how many of our seniors are isolated and have lost somebody.
Yeah. And all these services are free to the community.
Right.
This is a program that we run that's 100%
I just love what you
grants.
do. Mental health is so important.
It is.
And it's creating that that's people that are caring about people and creating the
connection.
dynamics of the community and
Absolutely.
serving.
Right.
So
Right.
how
Right.
does we're close. How does somebody get involved with that? I think maybe people are listening and said, I've got time. I would love to do that.
Absolutely.
Okay.
We'll listen to 70s music in my group.
Give me a call at the Polara Health main number, 928-445-5211, and my extension is 2035. And if I'm not in the office, I'll give you a call back and we'll get the ball rolling. And most importantly, we reimburse mileage.
All right, you heard it right. Your senior peer program, Polara Health. Thank you for both joining us.
Thank you
We're
so
out of time. We're
much.
taking a short break, and we'll be right back here on More Community Connections.